I'm a professional chef. I'm an executive chef all my life, and I do a lot of work with my right arm. That's everything that I use to chop, to cook, to move. And I had three previous surgeries before coming to Dr. Lynch. And she finally went and fixed it up, and I'm so grateful that I found her. And she just took the pain away, but she was able to repair a full movement that I was about to lose and actually risk my profession. She's great, and I've been already recommending her because to me, she's top doctor, and I'm very grateful that I found her.
I'm Dr. Jamie Lynch, and I'm an orthopedic surgeon. I specialize in shoulder, reconstruction, and sports medicine. I've been doing this for about 10 years in San Antonio, and I work currently at TruOrtho. TruOrtho is a very special practice in San Antonio, Texas. We're an all-women orthopedic surgeon practice of super subspecialists. Dr. Naomi Shields is a foot and ankle specialist. Dr. Amanda Marshall Rodriguez does hip and knee reconstruction, where I do all the sports and shoulder reconstruction. When you first come to TruOrtho, you're going to be met by a friendly staff at the front desk. You'll get set up, and then once you're set up and you've answered a lot of the questions on the paperwork, Elizabeth, our x-ray tech, will take you back for x-rays. And once your x-rays are complete, you'll go into your actual room. At that point, you'll meet with one of our friendly medical assistants, and we'll talk through what your problem is to a certain extent, try to get an outline of what's going on with your problem. Then I confer with my staff outside of the room, and then as I come back in the room, we sit and talk, and I get more detail from you about what your problem is, how long you've had it, what you've done to help it, what things make it worse. We then will go through some x-rays and a physical exam to really match up your imaging studies with what's going on in your shoulder or your knee. Once that's complete, we create a plan together, something that's either non-operative or operative, depending on what the problem is. And oftentimes we get options here, and that's when we talk about what fits your world at this time. Once we've closed out our interaction, you'll understand what the plan is, as well as I'll make sure I've answered all of your questions. And you go to the front desk, and we follow through with that plan, whether that's ordering physical therapy, or if that's ordering more imaging studies, or even setting you up for surgery. At that point, that's what we do. Here at TruOrtho, please call us at 210-878-4116, or look online at drjamielynch.com. That's drjamielynch.com. We look forward to seeing you here. Can't wait to take care of you.